Hi, I'm Sam.
Hi, I'm Pam, and we're part of the OARS program at FCS. OARS is a resource program for seniors living in Monmouth County.
Over the past few weeks, we focused our videos on mind, body, spirit, finding the fountain of youth, and overall well-being. We want to take things a step further and talk to you about things very specific to our aging, or renamed in the earlier videos, reinventing ourselves. Today, our topic is medications.
Here are a few statistics about older Americans and medication. 36% of Medicare beneficiaries take more than 5 prescriptions. 81% of adults 65 and older take at least 1 prescription daily. 30% of all over-the-counter medications are purchased by adults 65 and older. Older adults are 2 to 7 times more likely to experience adverse drug reactions than younger adults.
We are excited to have our first guest, Joanne Quinn, with us today. Joanne is the Director of Nursing in our Home Care Department at FCS. Welcome, Joanne. Could you explain what exactly is misuse of a medication?
Hi, thanks for inviting me to join you today. It's very important for you to take prescription medication exactly as it's been prescribed. For instance, if you're prescribed an antibiotic and the prescription says to take it twice a day for 10 days, stick to the schedule and finish the medication in 10 days. There has to be a steady amount of the medication in your bloodstream in order to completely eradicate the microbe that is causing you to be ill. If there is a lower dose in your bloodstream or you stop taking the medication because you feel better, it gives the microbe an opportunity to mutate. Your illness may come back and then it wouldn't respond to the medication because it has found a way to inactivate the antibiotic. Don't ever take a medication that has been prescribed for someone else, and don't share your medication with another person. Medications are prescribed based on a patient's individual needs with an eye toward other medications the patient is taking and allergies. It's a decision only a healthcare provider can make for his or her patient. I'm going to speak a little bit about side effects. Make sure your provider knows about any over-the-counter medications you are taking because some of them may interfere with prescribed medications, and be very careful of over-the-counter sleep aids. Specifically, the active ingredient in Benadryl or diphenhydramine can cause urinary retention, dry eye, dry mouth, an AM hangover effect, where it would make you tired to drive or walk around, make you dizzy, and it's been linked to memory loss in the elderly. Aspirin is another over-the-counter medication that is often recommended or prescribed by your physician. Be very mindful of the dosing. Comes in various different doses. Most people are prescribed 81 milligrams a day, so be careful when you buy it at the pharmacy. It can cause stomach upset. If that happens to you, you can get enteric-coated aspirin. This way the medication doesn't dissolve until it's in your intestines, so you have no problem with your stomach.
Hi, Joanne.
Oh, go ahead.
Hi, Joanne. When we get a prescription, and I know you've listed a lot of the side effects, usually in the box or the bag, there's an extensive list of possible side effects written in such small print that you'd have to use a magnifying glass to read the list. Can you give some generalized list of what potential adverse reactions one might expect from a medication and what they should do about it?
Yes, well, as I mentioned before, the sleep aids you have to be very careful of. They're going to cause a hangover effect in the morning most times. Some of the prescribed sleep aids can actually cause you to have very real dreams, almost delusional dreams, where you get up and make a sandwich and you don't remember about it the next day. Those are the most glaring. Anticoagulants such as warfarin or Xarelto can cause bleeding, can cause blood in your urine or your stool. It may take longer for wounds to heal. You need to let your doctor know immediately about something like that. And if you're taking warfarin, you should be going for blood work at a prescribed amount of time. The doctor will tell you when to go, and may actually be adjusting your dose to catch a therapeutic dose. They'll be looking at something called your INR, your PT-INR. And, you might have to change it a couple of times before it gets pretty steady. Medication for your blood pressure can cause dizziness, especially when rising from a sitting or lying position. Usually the only thing you can do about that is to just take it slow and steady, dangle your legs, sit still for a while before you get up so the dizziness will pass. Water pills or diuretics can make you, it will make you urinate more frequently in order to reduce the workload on your heart, to reduce your blood volume. Same thing with that. It's going to make you dizzy, can make you tired, can get you dehydrated, which will affect your memory. Unless your doctor tells you not to drink a lot of fluids, you should still continue to drink a lot of water. You need to hydrate yourself. Let me see, another one. Oh, medication allergies. It's very, very important that if you develop any kind of a rash, you stop taking the medication immediately and let your doctor know. You can develop an allergy to a medication just out of the blue. You could be fine with it for years, and then all of a sudden you start getting a rash. You need to call the doctor and stop the medication. A lot of the generic medications now have additives, and you might be allergic to one of the additives, so they would have to take you off that particular medication. I think we were going to talk about alcohol. Did you want me to speak about alcohol, Pam?
Sure, that would be wonderful.
Okay. If you're taking any prescribed medications, be very aware of the effect of alcohol on your medication, especially pain medication or any medication that can cause dizziness or sleepiness. Alcohol is a potent central nervous system depressant. Although initially you might feel better when you drink, you'll feel euphoric and happy. Eventually you're going to be sad, depressed, crying, and maybe you'll feel guilty too. Also, alcohol interferes with your wake-sleep cycle, so you may fall asleep quicker and you may actually pass out, but most likely you're going to wake up in the middle of the night and you won't be able to go back to sleep because the alcohol is going to affect your wake-sleep cycle. Also has a diuretic effect, so that's what's causing the headache in the morning. Sometimes you'll wake up in the morning, you'll have a headache. It's because you're dehydrated from the alcohol. Also wreaks havoc with blood sugar. It can cause a person who's diabetic to bottom out. Their blood sugar will go so low that they can't even really functioning, and you can have life-threatening hypoglycemia. Most medications are negatively impacted by the consumption of alcohol. It's very important to discuss alcohol consumption with your physician when he prescribes medication for your use.
Joanne, we've talked a lot about the adverse effects of medication, but what are some ways to assure that we're using and taking our medications safely?
Well, most pharmacies will call you to remind you to pick up your medication and will actually call your physician when you need a refill for you. Most pharmacies will deliver for free now because there's a lot of competition for your business. But especially the small local pharmacies, the mom and pop places, they want your business. They don't want you going to CVS or Rite Aid, and they're going to bend over backwards for you. Many prescription plans offer mail order service, so you don't have to do much of anything. The pharmacy is calling and getting your refills for you. Many pharmacies now offer what they call compliance packaging, where they'll package up your medication either in little packets with the date on it, the time that you're supposed to take the medication, the name of the pills in there, a physical description of the pill, for instance, Zoloft, small yellow pill. That way, if something changes or your doctor tells you not to take something, you can take it out of the pack and you'll be done with it. Also have what they call blister packs that look like a paper, and there's a little blister in there. Same idea, the date, the time, when you're supposed to take it, you pop it out and take the pill. It's a free service. I know Mattawan Pharmacy does it. There's a couple of others locally, and if you have any questions about it, let Sam or Pam know and I can get a list for you. They're all doing it now. They want the business. If you don't want the compliance packages, if you like to fill your pills yourself, use a med box and pick a specific day. For instance, Saturday night, I fill my med box for the next week and just fill them up. Same thing, if you have a question about it, let me know. So the med box, the pharmacist will help you with either option of those. If you prefer your vials and you want to keep it in, your regular vials and line them up, you could do that. Just ask the pharmacist not to put it in a child-proof container, as long as there's no children in the area of living with you. And finally, your own best health advocate. Make a list of any questions you have for your doctor before you go in, and have it in front of you. Take it out of your bag or your pocket and put it in front of you when you're talking to him, because most times when you go to the doctor, everything goes right out of your head, and he does all the talking and you forget to ask your questions. Be sure to tell him or her about any side effects you're having. Always keep a current list with you and keep it at home, and include prescription medications as well as over-the-counter medications.
Joanne, thank you for being a part of our video today. The information you gave us is really invaluable. I definitely need to update a prescription list for myself and my family members. And the other piece of information you gave about open communication between us and our doctors is really important. And unfortunately, for so many of us, this role is often so uncomfortable, we just ignore it. And we tend to relinquish our decision-making to the medical authorities and take a more passive role with ourselves. And oftentimes we find as we age that the physicians may underestimate the needs or desires that we have for information and make assumptions about us based on our age or our circumstance.
Patients need to assert themselves in a calm, direct, and concrete manner. Ask your doctor or pharmacist about the drugs being prescribed. According to research, only 1/4 of older adults ask about medication side effects. You are your best advocate. You're asking questions, advocating for you, may teach others to listen and ask questions and not to make assumptions. Maya Angelou said, "I learned a long time ago, the wisest thing I can do is be on my own side and be an advocate for myself and others like me."
You are your own best advocate. You know you best. Be safe, take care of you, and we want to meet you in person one day. Have a great day.